Good afternoon. Thank you all for joining us today. My name is Miranda Corton, and I will be helping with today's Cuyahoga County and Board of Health media briefing. We are joined today by County Executive Armond Budish, Board of Health Commissioner Terry Allen, and Board of Health Director of Epidemiology, Surveillance, and Informatics, Jana Rush. As usual, we will hear from our county leaders, and once the briefing is over, we will open it up for questions. So with that, I will now turn it over to County Executive Armond Budish. Thank you.
Thank you, Miranda. Good afternoon, and I want to start again by thanking Director Terry Allen, Jana Rush, and all the hardworking staff at the Board of Health for all the great work that they're doing. Thank you very much. Structural racism is hurting us badly in this country, in the state, and in Cuyahoga County. Of course, it's most directly harming people of color, but it hurts everyone. When some of us are kept down, we're all held back. Racial inequities have been highlighted by the pandemic. Black and brown people are getting infected, going into the hospitals, and dying at far greater rates than white people. We recently declared racism as a public health crisis. This declaration addressed all of the complex and interrelated effects of inequities. The county then stood up two commissions. One focused internally at county government, led by senior administration leaders, and the other focused on the community at large, led by a group of civic leaders. Both were tasked with looking at the root causes of inequity and how the county is addressing those. I've recently received initial reports from both, and I want to acknowledge the hard work that went into both those reports. They made a series of recommendations, and I am committed to following through on them. First, the county is committed to providing racial equity and inclusion training for all of our employees so that we all share a common understanding of racism and how it manifests itself both obviously and also unconsciously. Second, we're proposing legislation to create an Office of Diversity, which will focus immediately on our procurement policies and practices. The director will be a cabinet-level position. The county contracts with a lot of companies and people, and we want to make sure that all qualified businesses and individuals get a fair shot at doing business with us. We know that access to business is one of the things that's unequal through our community. The county's committed to seeing that change. Third, we're proposing legislation to define equity zones. These zones will be focused on areas where there are significant disparities in income and infrastructure. I've directed all my departments to take a look at the services that they provide and to make sure that we're giving these equity zones more focused consideration. A good example of how this can work is in our Public Works Department, where we recently announced our 2021-2022 road projects. When we decided where we would locate our projects, we took into account the economic health of that community based on a community's percent of households in poverty and average annual household income. Many of these communities also have higher levels of African Americans and Latinx people in them. So with the $17 million that we had for road improvements, we were able to propose important projects in Bedford Heights, Broadview Heights, Cleveland, Cleveland Heights, East Cleveland, Euclid, Maple Heights, Mayfield Heights, South Euclid, and Warrensville Heights, among them. Another example is our tree canopy work. Here we have a grant process where communities can apply to plant trees to improve their local climate and health conditions. Part of our decision in awarding these grants is the Vulnerability Index, which also is closely related to the economic health of a community. And our Department of Development has a long-standing policy of making sure that our business supports go to a high percentage of minority-owned businesses. We know that a higher percentage of Black-owned businesses were hit by the COVID economic crisis. Nationally, 44% of Black-owned businesses were closed compared to 17% of white-owned businesses. Locally, we worked to do better. Almost 60% of our small business stabilization grants, for example, went to minority-owned businesses. And with our restaurant stabilization funds, almost 40% of those dollars went to minority-owned businesses. We're making some progress. Now I want to talk about vaccines. This pandemic is a killer, and it's still roaring. Right now, it's most important to get vaccines into arms. It must be done in a fair and equitable way. But sadly, that's not happening right now. Minorities, people of color, are not getting a fair share of the vaccines. According to the Board of Health, we're seeing that 90% of the available vaccines are going to white people. Now, this is happening for a lot of reasons. Most important, more African Americans don't trust the safety of the vaccine. And the vaccine has been tougher to get in minority areas. We must address those problems if we truly care about fostering equity. So today, I'm joining Dr. Sherry Williams, the Diversity Committee Chair of the Cuyahoga County Board of Health, to make asks to the federal and state governments. First, target vaccines to strategic locations in underserved minority areas with community partners, much like we did when we greatly expanded testing programs to underserved areas, which we did in partnership with the Board of Health and Metro Health. Second, use trusted messengers to encourage minority populations to get the vaccine when available. For example, church leaders would be good advocates in Black communities. And third, allocate at least 20% of the vaccines to reach communities of color. This is critically important. Right now, our County Board of Health is doing what they can. Last week, they partnered with the Word Church in Warrensville Heights to get out more than 500 doses. And we'll continue to do what we can. This is the kind of advocacy that we need to make sure that people are not left behind. I'm committed to putting our county resources behind advocating and reaching out to let people know where and when vaccines are available, to help dispel some of the concerns and myths that are out there about the vaccine, and to ensure an equitable distribution. As a reminder, people can call the 211 line and get help with their questions and get help with registering for an appointment. If you're a Cleveland resident, there's another number to call, and that's 216-664-2222. So county residents call 211, Cleveland residents call 664-2222. In addition, the county has a webpage at cuyahogacounty.us/vax, that's VAX, where you can see if you're eligible for a vaccine, see a map of locations where doses are available, and read about the facts, not the myths, behind the vaccine. We're also part of a local collaborative marketing task force that's working on messaging about the vaccine. This task force was brought together by the COVID Rapid Relief Fund, the Cleveland Foundation, the Gunn Foundation, and the Mount Sinai Foundation. And it includes community members and advocates, communications professionals, and others. This is a crucial effort for the health and safety of every one of us. We need to get as many of us vaccinated as soon as we can so that we can all be safe. And now, I'd like to turn it over to Terry Allen.
Thank you, Executive Budish. We appreciate the support as always from the beginning of the pandemic. We've been working hand in glove with your staff, and you've been very supportive. I've said a number of times you have earned an honorary Master of Public Health degree through this response, and we appreciate that a lot. I also appreciate you acknowledging the leadership of Dr. Williams. She's a pulmonary doctor, critical care doctor at Metro, and was among the first people to be vaccinated in Cleveland when hospitals began their vaccination process. She would tell us stories about the folks she saw dying in the ICU and the heartbreak from the families from COVID. And we know the pain and suffering that it's caused in so many ways in our community. And so she was happy to line up not only as a pulmonary doctor, but as an African-American woman to demonstrate her leadership. And so we appreciate what she's done and her willingness also to do what she can to spread the word about the vaccine, its safety, so people can make the right decisions about getting vaccinated. So as of February 1st, we know that Ohioans over age 70 and of course those that are older and employees of schools K through 12 are now eligible for vaccinations. We've had some questions about schools, and we've been actually doing calls since probably graduation last spring with the superintendents in the Educational Services Center that coordinates the calls, and we appreciate their support. And we learned today in a call with them every Friday, we talked that, of course, the idea here is we're dividing up and spreading out the responsibilities on vaccination. We have, as you know, over 80 providers working on 1B in a county of 1.2 million and a population of over 230,000 seniors. So having different providers gives people a choice and opportunity close to them where possible. But the schools are working here in Cuyahoga County with the pharmacies. There are several pharmacies that will be working to vaccinate in the coming weeks, 23,000 adults working in schools. And so it's an important phase because we know many kids' education has been disrupted by the pandemic. Many have been either remote or they've been hybrid or some portion of that, and it's affected their socialization, their interaction, and it's caused a lot of difficulties. So this is an exciting time to protect the adults working in schools. So we know that on February 8th, Ohioans 65 years of age and older will become eligible as well. Yesterday, the governor announced that Ohio will hold then at that level, will hold for several weeks in the 1B phase to reach as many of our seniors as possible. We moved through these tiers over the last few weeks, but we know there's still a lot of work to do among our seniors, given the great number in our community. The governor also shared some news from Pfizer, as they indicated that they'll be able to increase the level of shipments of vaccine by 40% in the middle of February, which should mean more vaccine for Ohio and our community. Pfizer also noted the current allocations, which are about 73,000 per week for Ohio, should double by the end of March. That's very, very good news. Moderna doses have increased from 73,200 in Ohio to 105,600 for next week. And it's also been reported that Moderna may have the ability to increase the number of doses per vial from the current 10 to as many as 15 per vial, expanding opportunities for vaccination for everyone. This is, of course, as you mentioned, very good news and a reminder of how fortunate we are in the United States to have wider access to vaccine now and in the coming months, as many countries may not have access to these life-saving vaccines until 2022 or 2023. In this response, as Executive Budish noted, equity in the distribution of vaccine is essential. It is our North Star in public health. We need reliable data to focus our efforts to assure that we reach vulnerable and under-resourced communities in this response so that everyone has a fair opportunity to access this valuable resource. Back in the spring, we worked with the labs and testing agencies to improve reporting of race and ethnicity data. In a similar way, it's essential that all of our vaccine providers work to assure that we provide accurate race and ethnicity data on vaccination. Currently, as Executive Budish noted, we are seeing about 90% of our vaccines from the state data that are going to folks who are white. And we also know that about 10% of our overall vaccinations in the county, we vaccinated to date about 97,826 people in the county. 10% of data is missing for race data in the county. So we need to improve that in the same way we work with our providers. What's more, ethnicity data is missing on 25% of those vaccinated. So we are asking all our providers to increase efforts to fill gaps in these data for accurate reporting and to help us focus our efforts. So support an equitable vaccination campaign. We'll be using a number of pathways to support that going forward, working with senior centers, working with our faith-based community, working with community health workers, and a range of venues to close that gap that the executive pointed out. Changing gears, you'll recall that Cuyahoga County had extended the stay-at-home advisory until January 31st. We know that agencies and public settings were tracking these extensions that often only span several weeks, and they'd be waiting to hear what would happen next with the extensions. And so while we have recently seen some welcome decreases in case volume that Director Rush will discuss, we are still over 4 times CDC's threshold for high transmission and remain red or at level 3 public health emergency here in Cuyahoga, along with 84 total counties in the state. After considering all the factors, the Cuyahoga County Board of Health had determined that the current stay-at-home advisory will not be extended at this time. We highly recommend that residents continue to follow the guidance that details the effective prevention measures that reduce the risk for COVID transmission. We know these prevention measures work. We should not let our guard down or consider the threat of COVID-19 transmission to be a thing of the past. It remains ever present, particularly as variant strains emerge across the U.S. It's more important than ever to follow our guidance from local, state, and federal officials in regard to slowing the spread of COVID-19. This includes compliance with Ohio's curfew that is tied to case levels across the state, and we'll be watching that closely as the state makes decisions about the curfew in the coming days and weeks. Residents should still stay at home to the greatest extent possible and avoid crowds and environments that encourage larger groups of people to congregate. Large gatherings, parties, and celebrations should still be postponed so we can continue to reduce transmission rate while increasing the number of Cuyahoga County residents vaccinated against the virus. Please continue to wear masks, maintain safe social distance from those you don't live with, wash your hands and use hand sanitizers frequently, and sanitize commonly touched surfaces at home. Those infected with COVID-19 need to isolate themselves to protect their friends and loved ones, and those exposed to someone infected still need to quarantine according to public health guidance. In support of the progress made in slowing the spread of COVID-19 transmission, we have to stay vigilant and play both defense, which is wearing our masks, distancing and washing our hands, and offense, increasing the number of those vaccinated against COVID-19. We'll continue to review the data, the decisions from the governor relative to the state curfew, and continue to work in collaboration with our partners in making future decisions. So I'm happy also to report that by Sunday evening, by sundown, coming up this weekend, Sunday, we'll have provided 13,200 vaccinations to approximately 9,300 people using 80% of our first dose supply so far this week. So we get doses shipped every week. So the reason there's a difference between those numbers is we're starting second doses for people that were in Group 1A. We continue to work through a list of still about 2,000 people that are eligible under Phase 1A group, including patient-facing healthcare workers not connected to the hospitals, EMS, developmentally disabled populations that are living in group homes. According to the Department of Developmental Disabilities here in the county, there are about 550 facilities serving the developmentally disabled through the community. So that's a large number of facilities, and they're a very vulnerable population that we want to make sure we serve. Many of these individuals can't come to our large pods for vaccination, and our medical director, Dr. Heidi Gullett, has led a mobile team of doctors to vaccinate in these locations. And we're working with our Board of Developmental Disabilities to work through the list of group homes and coordinate with them. So you're going to see this overlap between 1A and 1B going forward here in the near term in the few weeks. But we're down from a list of about 15,000 people that were on our 1A list, so we've made great progress. As you know, the Ohio Department of Health posted information of all the providers for 1B on their website, and they include federally qualified health centers, home health providers, hospitals, select pharmacies, and health departments. There are over 80 providers on that list from across the county, and they get vaccine distributions once a week. Governor, given the positive news from the governor about the potential increase in allocations in the coming weeks and months, we're glad that more seniors will have access to this life-saving vaccine. Again, I'll remind you, there's a text version on our website of these locations with phone numbers and websites. And we know the demand certainly far outweighs the supply of our current around 150,000 doses being distributed from the state. So we have to continue to be patient, but we're seeing hope. We're seeing glimmers of light here in the middle of February and then into March with more vaccine becoming available. So those who are eligible and wish to be vaccinated for 1B will need to directly contact these providers to schedule a vaccine. Phone numbers and web links are available to call these providers to do the scheduling. It's important to remind everyone, if you've signed up through our website and you are sent the opportunity either through a text, a voicemail, or an email, or all three, to sign up, that you need for a second dose, it's important that you fill out your registration form, have it completely filled out in advance. And we give you that on the voice message to make sure that's done. And bring your vaccination card. This will ensure that we can move folks through the drive-through clinic as smoothly as possible. So again, bring your vaccination card and fill out your registration form. Vaccine providers are urged again to consider issues that may impact the ability of seniors to access vaccine. And again, we're working with the Department of Senior and Adult Services, the Western Reserve Area Agency on Aging, the library system, and of course 211 and the 15 operators there funded by the county to assist seniors for vaccination opportunities. We'll continue to urge providers to eliminate barriers to healthcare access for these vulnerable populations, including the lack of adequate transportation and handicap inaccessible locations, computer literacy challenges, and employment that does not offer paid time off for medical appointments. When planning appointments for clinics, vaccine providers should consider strategies to negate potential barriers to access and help ensure vaccine availability for members of vulnerable populations. You need to have flexibility in your scheduling and advertising on print materials at grocery stores and faith-based organizations, partnering with churches and libraries and community centers for clinics, and ethnic media and trusted leaders, after-hours appointments and weekend services, as well as mobile vaccination services or clinics with walk-in options. Again, I've repeated this before, but it's important to note that you need to ensure that identification requirements are used to verify name and date of birth, not residence or immigration status. We need to protect our seniors against scams or fraudulent attempts to access financial or other personal information. So we encourage everyone to stick with the provider where you got your first dose to get your second dose. And again, if you got Pfizer for your first dose, you get Pfizer for your second dose, Moderna for your first dose, Moderna for your second dose. And each provider will identify that process for getting the second dose. Again, side effects could be mild arm pain at the point of injection, headache, fatigue, or slight fever that could go away in 1 to 2 days. And the symptoms may be more pronounced on that second dose as part of your body's normal immune response. You can talk with your doctor if you have a history of allergies to vaccines or other bad reactions. So as I close here, we want to remind people to continue to wear masks, to wash hands and social distance after receiving the vaccine. And we'll need to do this for several more months as everyone gets vaccinated. So we know this is working. The numbers are dropping. That should be the encouragement that we all need to continue down this path. We've come too far. We've come too far now not to continue our vigilance so we can all get a little closer to returning back to the life as we'd like to have it, back to our sense of normalcy. So today, I'd like to take an opportunity to thank a couple groups that have been integral. And we've had so many wonderful things in this response happen the way that people have stepped up as public servants. It's been remarkable to me. We have a cluster team that's been working for a long time. I'm looking at Director Rush. They've been in charge of identifying where clusters of cases have occurred and then working to stamp out those clusters and control spread. So I want to give a shout out to our cluster team that's been working hard on these clusters, helping to rein them in, to identify cases, to look for secondary cases, and to limit community spread. So hats off to them. I also want to note our logistics team. These are the folks that are hauling equipment back and forth to pods around the county at e-check locations and firehouses and the fairgrounds and other locations. And they're up at the crack of dawn, showing up to pick up the equipment and deliver it and set it up at these locations. And they're often home well after sundown as they break down the sites and then transport the equipment back for the next location. So hats off to them as well and their commitment to serve the public we all know that every shot in the arm is our day closer to getting past this pandemic. So thanks for listening, and I'll turn things over to Director Rush to review the data brief.
Good afternoon. And I know we are working to pull up the slides. As of today, as of yesterday, we had over 64,000 cases reported to date, with 2,200 new cases reported over the past week. Our daily average case volume has consistently decreased over the past 3 weeks. An average of 270 cases per day are being reported currently. During our peak in December, we were over 600 reports being received daily. So a significant decline over the past several weeks in relation to our case volume. We have over 3,700 hospitalizations that have been recorded to date, with 86 of those reported over the past week. That's a slight decline from the previous week. We went from 5.9% to 5.8% this week. Over 1,200 deaths have occurred to date within the Board of Health jurisdiction. An average of 7 per day have occurred throughout January. That's a decline of over 50% from where we were in December. So again, another significant decline in the number of deaths that are being reported daily. 39 new deaths were reported over the past week. And again, that's a decrease from what we received for reports the previous week. We can go to the next section. And so for our case demographics, those continue to remain stable. About 40% of our cases are over 50 years of age, and they also represent the largest proportion of hospitalizations. About 75% of that population is hospitalized out of all of our other age groups. We can go to the next section. So our Epi Curve, as you can see, we continue to see that spike that was beginning in November, and it continued throughout December and also as part of the beginning of January. So our cases day to day have begun to stabilize. So we're not having as much variation as we were having several weeks ago with day to day, the number of cases that we were receiving. So our average remained high, but some days we could have a lower number of case reports, and other days we would get a really high number. So that's began to stabilize as well over the past week or two. Next section. So here is our geographic distribution of cases. Again, this has also remained stable. The northeast part of the county continues to have a higher proportion of cases, as well as parts of the northwestern part of the county and southwestern part. So that hasn't changed much over the past several months. Next section. And so for our hospital utilization, our critical care adult bed utilization has increased slightly by 2%. So we were at 78% last week, and now we're at 80% utilization. Our ventilator utilization has also decreased, but just slightly by 1% from the previous week. So we are currently at 41% usage, and we were at 42% usage from the previous week. Next section. And so for our testing rates, so the hospital testing positivity rate, it has continued to decline. As you can see, from the beginning of January, we were at close to 21%, and now we are at about 11% reporting. So that has continued to decline week over week. So over the past 4 weeks, we have seen that decline. And so that's almost half, although there has been less testing done. So there were more tests that were completed at the beginning of the month versus towards the end of the month. And then for our nursing home positivity rate, that has also decreased, but only slightly, about 1%. So we're still really at a high level of positivity rate in our nursing home population, where we know more severe outcomes are possible with that population. And so we'll continue to monitor that situation really closely. Next section. And so this is new information that we will begin to have included within our data brief, our vaccination data. So this provides coverage for the entire Cuyahoga County area. So as of the end of January, 91,536 individuals began vaccination, started vaccination. And so that's a little over 7% of the population of 1.2 million that have been vaccinated as of the end of January. So we'll continue to monitor this and add additional information as it becomes available. And so just to put the data in perspective, the case trends continue to move in the right direction. We're past the holiday season where we had a lot of travel, in part, which led to a lot of transmission happening throughout the county. And as the vaccine coverage increases throughout our county, we are hopeful that the transmission rates will continue to decline. And so that ends my portion of the presentation. And so I will turn it over to Miranda. Thank you.
Thank you, Jana. We will now open it up for press questions. So any media with questions, please go ahead and unmute yourself and state your name and go ahead with your question. Thank you.
Hi, this is Lisa Ryan from 90.3 WCPN. And I have a question about when you say that you're going to put vaccine sites in minority areas. I'm wondering how you're going to make sure that only people in those neighborhoods will be able to access it and other people won't come in and get the vaccine.
Thank you, Elisa, for your question. It's a good question. So we have the ability through our links that we send out to people that are eligible for vaccination to actually set up a number of separate links. We've done that, for instance, for the developmentally disabled populations, where we had a set of group homes where people were able to come and they were mobile and they could come to a vaccination site. So we're able, working with our County Emergency Operations Center, who, by the way, that's those folks are under the responsibility of Executive Budish. They've been fantastic from the beginning. They can help us to set up a link specifically for populations so that we can sign them up. So similarly, we can work using our sign up tool to assure that zip code areas or certain places specifically have access to gain vaccinations. And so right now we're developing some plans. Dr. Williams is chair of our diversity committee here at the board, as Executive Budish noted. And we're going to be talking about vaccination equity and a number of different pathways to reach folks, and certainly using the ability to have links that are controlled perhaps by folks who are doing direct outreach to seniors, and they can help them sign up and ensure that their folks who gain access are from the neighborhoods that we're trying to reach, in the areas we're trying to reach, to work toward those goals of equity.
And it's not like,
okay.
You know,
and when will we see those sites go up? Oh, sorry.
No, that's okay. I was just going to add that, you know, when the Board of Health went out to the Word Church, for example, you know, the people who came to get vaccinated were largely either members of the Word Church or lived in the area of the Word Church, in part because of the location and in part because the word got out through the Word Church. So, you know, it's a function of messaging and it's a function of location of the delivery point.
And I would add to Armand's point that what we will look at, Lisa, is sort of a combination of efforts. So we still have a number of first dose for 1A. So these are profession-based guidance, right? If you're in a group home, so we have very specific, guidance from the state on 1A. So we're going to continue to finish up our 1A folks. We're going to continue to do our first and second dose for that population. We have our mobile team, as I mentioned, Dr. Gullett and the group out working in group homes. And we're also going to be interspersing a team that will go to locations to address the equity need to address the equity gap. So that plan is still being formulated. I think we'll have something probably more formal in terms of an approach in the coming weeks here, but we're going to begin doing those in some pilot projects, but we're not ready to sort of lay that out yet because we're still working on the plans. It's really important that we find that if you're going to be working with the community specifically, that you're engaging the trusted leaders in the community to make sure you determine the best way for outreach. What are the transportation supports that may need to be in place in order to assure that people can get there? And how do you reach folks that may not have internet access? And a number of pathways through trusted sources are available to do that. So it may mean that we're not obviously doing these 1,000 person pods, but they would probably be smaller venues where we're able to reach people. And then we'll have to test out what's working, what people feel comfortable with. And it'll kind of be an iterative approach, I imagine, as we learn going forward.
Thank you.
Sure.
Hi,
Thank you.
Emily Bamforth, Cleveland.com and the Plain Dealer. I'm following up a little bit on schools. Obviously, the ESC is coordinating a lot of this, but you guys have been on calls. So I wanted to pick your brain a little bit. In terms of vaccination sites, I'm hearing from several school districts that teachers will be vaccinated off-site and that they may be at the ESC in Independence. Is there going to be a central location for Cuyahoga County schools at the ESC in Independence, or will there be multiple sites? And also, are there any supports that the county plans to offer in terms of transportation or anything like that to help out staff or school teachers that may have some difficulty getting to a central location?
So thank you for your question, Emily. So we had a discussion today, and we have a very specific call with the Educational Service Center leadership on these details to help walk them through. We spent most of today answering vaccine questions about efficacy, about safety, about side effects, a number of things from a planning perspective that the schools had to think about that we've been learning about along the way. But we have a call to discuss their approach for vaccination. Certainly, the schools have lots of transportation they can afford their teachers and workers if they have some difficulty getting to these locations. And, we've been impressed in our coordination with the superintendents and the Educational Services Center and tried to provide any background information and experience we have for them. But we have a call scheduled to get into some of those details. But today was very much focused on our experiences with the vaccine and what they're doing toward gearing up toward that March 1st date, toward a hybrid or full face-to-face, and what we were going to be doing with them around reducing the potential for transmission. But we're grateful that the pharmacies are taking on this responsibility. It allows us to stay focused on finishing 1A and focusing on the seniors and our equity plans.
Just to be clear, they didn't talk about vaccine locations or anything that's set in stone there yet?
We didn't discuss the details on that plan, and it may very well be set in stone. We just didn't talk about that today.
Okay, thank you.
Sure.
Hi, this is Courtney Estalsi, also from Cleveland.com, Plain Dealer. Terry, at the beginning, you had mentioned, that we still have a high transmission rate here. We're still level 3 in the state. And then you said after considering all the factors, the Board of Health decided not to continue the stay-at-home advisory. Why did the Board of Health decide not to continue the stay-at-home advisory?
Thanks for your question, Courtney. Back to kind of the way I described it in my comments, we know that we've been getting calls from people saying, are you going to extend a week? Are you going to extend 2 weeks? They're thinking of it from a planning perspective. And we felt similar to other urban counties. I know Dayton Montgomery has taken a similar approach where we want to just sort of as a default, highly recommend that people continue to follow what's been working and didn't feel that the 1 to 2 week extensions, watching to see what was happening with the governor's curfew. And we know that the governor's considering some different things with the curfew as well, that it made sense to just reinforce the need that it be a default position to follow these recommendations rather than a 1 or 2 week extension on the guidance, which we think applies and will continue to apply going forward in this near term because we still have high levels of cases. So we are, I know that some people are thinking, well, we're moving in the vaccination phase, but we want to make sure that they understand that they continue to follow this guidance because, we want to concentrate on vaccinating and concentrating on what's working from a vigilance standpoint. So that was our rationale and approach.
Okay, so your general advice to people is to continue basically behaving as if that was like, don't change anything, what they're doing behavior-wise?
Right. We want them to continue doing what's been working. Our numbers are dropping. So if it ain't broke, don't fix it, right? So that's kind of my view at this point. We know that we've gotten great, we've had great benefits, the science around social distancing and making sure you stay home when you're sick. And isolation and quarantine is very solid now. We know it's working. And so stick with it, avoiding large gatherings, following the governor's orders and the other guidance that's come from the state. And we know that that's working. So we're telling people to continue doing that. And we'll keep you posted going forward. But I think our progress should be motivation for us to continue. A combination of these tried and true prevention measures with vaccination is our ticket out. And that's what we want to encourage people to do.
Okay, thank you.
Sure.
And I also was hoping to clarify something that Lisa had asked about earlier, the potential for vaccination sites in minority communities. The Board of Health hasn't, like you said, it started doing 1B vaccinations itself. Would you envision that these sites and communities would be part of your eventual efforts to do 1B vaccinations? Would that be for later groups? Who would that be applying to?
Thanks for your question, Courtney. So we have started doing 1B vaccinations, as I think Executive Budish noted. We began doing those at the Word Church location, which we did last weekend. So we're really in this combination of doing both 1A first dose, 1A second dose, and 1B. And we're going to be in that mode, I think, for the next few weeks. And so we would see, given that we're going to be in this holding pattern for seniors after next week when we start getting into the 65 and older, we're going to be in a holding pattern. We're not moving on to subsequent phases that the state may develop so that we can continue to take care of this vulnerable population. And yes, we would see our work around equity and vaccination to focus on the 1B population.
Thank you.
Welcome.
Thank you, Courtney, for your questions. Are there any other questions? Okay. That concludes our media briefing for today. So thank you all again for joining us and have a